Well, the time has finally come for us to reach the very last video in the very last module of Community Care's mental health response training. And it seems apt that we should take what we've learned and try to apply it to cases of actual people. So let's take a look at how well you assessed Ms. Violet and Ms. Q. As it turned out, Miss Violet's problem was not really a psychological disorder as much as a psychological problem. She was a lonely and disconnected elderly lady, and she really wasn't presenting at this point any signs of danger. What she was really more of a bother and annoyance, and she didn't know how to go about getting her needs met. She needed to be connected with other people, and this was largely achieved by connecting her through a program literally called the Friendly Visitor Program offered by Mission Community Services. And this program is simply a program where seniors, volunteers, go out and connect with other seniors who might otherwise be completely isolated. And this is a healthy and social beginning of a relationship that can sometimes blossom into other relationships. For example, perhaps this relationship can lead a person to feel more confident in going out and meeting new people or getting out into their community. And in this particular case, it was important for the individual, Miss Violet, to get a little bit connected to youth and to her neighbors. And this could be accomplished through facilitation, the gradual facilitation of this friendly visitor volunteer. We also needed to address her underlying healthcare needs, encourage her to go and see her family doctor, make sure that she was eating right, make sure that she was sleeping right, make sure that she was getting outside for fresh air and for sunlight, and all of those sorts of things were facilitated mostly through a person who was not in any way paid and was really just coming by for a few hours a couple of times a week. And the other thing that we wanted to work towards was a possible but gradual reconnection to other members of her family. And this is something we would explore in a really gradual way. And it turned out that Miss Violet lived literally just down the street from a school, from a preschool, and from a church. And if there was an opportunity for us to reconnect her with any of those types of organizations, whether it be a faith community as a worshiper or the faith community as somebody, for example, doing childcare or other volunteer work, there's a way for us to help that person become more socially included. And we need to remember that churches are not just for people who are particularly of faith. Lots of things happen in churches and in church basements that are of community interest, such as kitchens for people who may be indigent, or meetings or gatherings in the space that churches rent out. And so it can be as simple as just finding out what the amenities are within walking distance for a person, and that was largely what Miss Violet needed in her case. And then some of those particular connections led to more advanced connections, such as a reestablishment of a relationship with her own children. Now, Miss Q is quite a different individual. Her behavior was growing more and more disruptive and threatening, and this was suggesting a potential danger to her neighbors and to her neighbors' cats, and a worsening pathology. And this meant that she in turn was in some danger, because she could have had encounters with the law where she ended up being charged or potentially having to go through the system. And of course, it meant that her mental health seemed to be in decline. She needed to be connected to some sort of mental health service, but this was a very difficult thing to do for a number of reasons. First of all, she wasn't a homeless person, she wasn't a drug addict, and she wasn't someplace where an outreach worker would have encountered her. And in our particular community, we do not have a CAR 67 type of service where a mental health worker can be out with an RCMP member and start to gradually get to know an individual such as this, or even field their phone calls. Instead, this individual really just kept encountering different RCMP members and was very, very aversive to speak to, so she was effective at alienating people. And I can tell you that she was very difficult to speak to, because I spoke to her on a number of occasions and found that she was, tended to be completely unresponsive to anything a person was saying, B, she forgot everything people were saying, and C, she would quickly become irritated and threatening, and then would just simply come back the next day. All of these things were behavioral patterns that suggested a poor psychopathology and potentially a personality disorder, and that she needed more help. So what we did is we actually had a social worker go out with an RCMP member, but this was a rather perceived as an affront by this particular individual, and did not have the desired effect, because it was a rather sudden approach, and I think she saw this person as being a threat as a threat that she was going to be locked up if she didn't suddenly change her behavior. And what she did to change her behavior was simply stop contacting myself and a few others, but that didn't stop her from making phone calls altogether. And the problem is that while it might have been more easy for me to manage as a result of that intervention, it didn't necessarily address her underlying issues, nor did it address the potential threat to her neighbor or to her neighbor's pets. So we really needed to be able to have an approach of gradually exposing this individual to somebody who would be able to relate to them, however challenging that might have been. And to be blunt about it, most likely the person who would be in that position would have been either an RCMP member or one or two RCMP members with whom she had perhaps an evolving amount of comfort with. And if she had had those responses perhaps over a period of a few weeks, there might have been a potential to gradually expose her to this mental health social worker in a way that was a little less abrupt and confrontational, and potentially to suggest to this woman that she have an opportunity to be connected with her general practitioner or with somebody else that was perhaps a community social service provider. And even if none of those things had happened, the RCMP member being involved would have made for an opportunity to monitor this individual's condition and, if necessary, take them under a Section 28 toward the health care that they needed. This person was very lonely, just like Miss Violet, but that might have been secondary to a personality disorder. As I mentioned, she was unmarried and had never been married, and she did not have a wide social circle. So this was a very difficult thing to do because people found it difficult to deal with her. What we could do for this person is do something in the way of mediation, or at least offer mediation services through a program such as Mission's Restorative Resolutions program, where we could at least achieve some amount of peace between the two neighbors. It isn't that we were looking to create a more healthy, long-term, socially enhancing relationship, but simply to stop having this source of conflict in her life. And potentially to have an opportunity for other gradual relationship building, as we said, starting perhaps with even the first responder and literally gradually working towards a connection through a regular GP. And we talked way back earlier in the module about the fact that sometimes a crisis in its own odd way can be a blessing. And in this particular circumstance, the individual was very, very difficult to help pre-crisis. They really were not receptive to help. They really saw their issue as particularly being this sort of phantom behavior from their neighbor and the fact that others weren't responding. And in the end, probably the best thing that we could do for this person was to try our most earnestly to help her before a crisis, but to be able to respond adequately if a crisis did occur, and not just in the situation of the crisis, not just reactively, but in helping her over long term in a proactive fashion. And that is probably as good a place for us to end this course as anywhere, talking about the idea that as mental health responders in our community, we have the opportunity to take lemons and turn them into lemonade, to help people turn a crisis into an opportunity to start to receive both professional and informal supports that will proactively help them to improve their mental health, making their quality of life better, and improving our community for everybody. The fact that you have taken this course really speaks to the idea that you're committed to helping in your community in a way that has sort of a long-standing but somewhat forgotten tradition here in Canada. And we really want to see neighbors reaching out to each other, even though in many cases it's not the easiest thing to do. We cannot rely entirely on professionals, and sometimes the only way a professional even knows about an individual with significant mental health needs is through a community member identifying and making a connection. And it's really important for us to realize that in the same way as we might have to call an ambulance when we see somebody having a physical crisis, we need to be able to engage services and engage in formal supports for people if they look like they're going through mental health crisis. I am so thrilled that you took this course with us, and if you have started at Module 8 and want to try others, I hope you will take a look at all of those. The fact that you're doing this has really reflected to us that Mission and any of the communities that people have taken this course from are populated by people who really understand what community means. You are a rock star for taking this course, and thank you very, very much. Please feel free to pass along your comments to us, not only in your course feedback sheet, but in any emails or messages you want to send to us. And also please feel free to send the course on or let other people know about it. We would be thrilled to have more people taking it from all across Canada and frankly anywhere else for that matter. Thanks again, and we hope you found the course rewarding and informative, and we most of all hope that it will help change something in the way you live in your community and perhaps practice your job. Thanks so much, and all the very best in your life.